Our patient Thomas presented to our office in July 2013. Thomas was an avid athlete, a very highly regarded tennis player locally and even in the state. He suffered a concussion in January 2012, and following the concussion, he found himself in a situation where he had difficulty doing many of the day-to-day tasks that he used to be able to do without any trouble.
So it wasn't recommended. I honestly don't know, because I had no idea what vision therapy was before my physical therapist said anything to me. I remember right before the accident happened, I'll call it, I was playing really well and I was doing things well, and then the accident happened and I didn't touch a racket for 3 months, and I couldn't even, when I got back, I couldn't remember how to hit a ball very well. I think you kind of get down when you realize what you were before, and then you kind of look at what yourself is now. That's probably the worst part, in my mind at least. I went to physical therapy first, and that helped. And then my neurologist took me off my medicine, and then I kind of had like a relapse. I felt worse, and then it happened again, and then I went to physical therapy again, and then and that's when I kind of felt like, is it ever going to get better? Or is it just going to be like this for the rest of my life? Am I going to be dizzy every day? Am I going to feel nauseous when I wake up? And then my physical therapist sent me to vision rehabilitation, and now it's gotten a lot better. So what I've noticed that's have changed since I've started here at vision therapy is that I can read faster now, and I don't get as many headaches, thankfully. And then when I'm reading, I have a better attention span to focus on the words than what I did before, and I can read for longer periods without getting distracted by things that were outside of the book or whatever I was reading. And then also, I just realized that I need to use my peripheral vision more than and then instead of moving my head all the time, just move my eyes instead of my head. Before, I used to be really dizzy all the time, and I would kind of have to hold on to things at points, but now it's much better. I don't have to do that. It's gotten a lot better, and I just feel like I can perceive things like the depth of how far they are better. Now that I've gone through vision therapy, I actually watch the ball more. I didn't watch the ball very well, but now I actually watch it all the way to the racket, which is what you're supposed to do, so that's good.